Conditioning theories. According to classical conditioning, a natural stimulus, when repeatedly associated with an aversive experience, unconditioned stimulus, UCS, that leads to experience of anxiety, unconditioned response, UCR, becomes associated with the aversive experience. It acquires the capability to elicit a similar anxiety response, conditioned response, CR. The emphasis in classical conditioning is that human fears are acquired as a result of some natural stimulus, for example, visit to a dentist's office, coming into association with some previous anxiety-provoking experience, for example, a highly painful and terrifying experience at the dentist's office when a child. Although numerous experimental studies over the past 80 years have demonstrated that fears can be acquired in the laboratory by repeatedly pairing a natural stimulus with an unconditioned stimulus, the model could not provide a credible explanation for the remarkable persistence of human fears in the absence of repeated UCS-CS pairings. Maurer introduced a major revision to the conditioning theory in order to better account for avoidance behavior and the persistence of human fears. Referred to as two-factor theory, it became a widely accepted behavioral account of the etiology and persistence of clinical fears and anxiety states throughout the 1960s and 1970s. Although no longer considered a tenable theory of anxiety, the two-factor theory is important for two reasons. First, many of the behavioral interventions that have proven so effective in the treatment of anxiety disorders had their origins in the two-factor model. And second, our current cognitive models of anxiety were in large part born out of the criticism and inadequacies of the two-factor theory. In the two-factor model, the first stage of fear acquisition is based on classical conditioning. Little Hans experiences a traumatic event, seeing a large horse fall to the street and thrash about violently, UCS. This elicits a strong fear response, UCR, so that the sight of horses, CS, through association with the UCS, is now capable of eliciting a CR, fear response. However, fear persistence is explained at the second stage because of extensive avoidance of the CS. In other words, Little Hans stays indoors and so avoids the sight of horses. Because of avoidance of horses ensures that Little Hans will not experience fear or anxiety. The avoidance behavior is negatively reinforced. Avoidance is maintained because fear reduction is a powerful secondary reinforcer. Furthermore, because he stays indoors, Little Hans fails to learn that horses do not regularly fall down. In other words, he does not experience repeated CS, only presentations that would lead to extension. By the late 1970s, serious problems were raised with the two-factor model explanation for human phobias. First, classical conditioning assumes that any natural stimulus can acquire fear-eliciting properties if associated with a UCS. However, this assumption was not supported in aversive conditioning experiments in which some stimuli, for example pictures of spiders and snakes, produced a conditioned fear response much more easily than other stimuli like pictures of flowers or mushrooms. Second, many individuals who develop clinical phobias cannot recall a traumatic conditioning event. Third, there is considerable experimental and clinical evidence of non-associative learning of fears through vicarious observation, witnessing someone else's trauma, or informational transmission, like when threatening information about specific objects or situations is conveyed to the individual. Fourth, people often experience traumatic events without developing a conditioned fear response. Again, the two-factor model requires considerable refinement to explain why only a minority of individuals develop phobias in response to a traumatic experience, for example, painful dental work. And finally, the two-factor theory has difficulty explaining the epidemiology of phobias. For example, fear of snakes is much more common than dental phobia, and yet many more people experience the pain of dental work than are bitten by snakes. Although various refinements were proposed, it became clear that the two-factor theory of conditioning was unable to explain the development and persistence of human fears and anxiety disorders. Many behavioral psychologists concluded that cognitive constructs were needed to provide an adequate account of the development and maintenance of anxiety, even phobic states. A variety of cognitive concepts were proposed, for example, expectancies, self-efficacy, attentional bias, or threat-related schemas as mediators between the occurrence of a fear-eliciting stimulus and the anxious response. Not all behavioral psychologists, though, embrace cognitive mediation as a causal mechanism in the development of anxiety. An example of a more non-cognitive perspective is the fear model proposed by Ullmann and Minnick. The fear model. Ullmann and Minnick state that because fear evolved as a defense against predators and other threats to survival, it involves a fear model composed of behavioral, psychophysiological, and verbal cognitive components. A fear model is defined as a relatively independent behavioral, mental, and neural system that is specifically tailored to help solve adaptive problems encountered by potentially life-threatening situations in the ecology of our distant forefathers. They discuss 4 characteristics of the fear model. First, it is selectively synthesized to respond to stimuli that are evolutionarily preponderant because they pose particular threats to the survival of our ancestors. They reviewed a large experimental literature that demonstrated selective association in human aversive conditioning in which individuals evidence better conditioning and greater resistance to extinction for phylogenetic stimuli than for ontogenetic materials. Ullmann and Minnick concluded that 1. Evolutionarily prepared fear-relevant stimuli have preferential access to the human fear model, and 2. Selective association of these prepared stimuli is largely independent of conscious cognition. A second characteristic of the fear model is its automaticity. Ullmann and Minnick state that because the fear model evolved to deal with phylogenetic threats to survival, it can be automatically activated without conscious awareness of the triggering stimulus. Evidence for automatic preconscious activation of fear includes physiological fear response to fear stimuli that are not consciously recognized, continued conditioned fear response to non-reportable stimuli, and the acquisition of the conditioned fear response to fear-relevant stimuli that were not amenable to conscious awareness. A third feature is encapsulation.